Are you ready, kids?
Aye, aye, Captain!
I can't hear you!
Aye, aye, Captain!
Oh!
The novel virus was first identified in Wuhan, China, in December 2019. A lockdown in Wuhan and other cities in Hubei province failed to contain the outbreak, and it spread to other parts of mainland China and around the world. Our topic of this project is the thing which changed us is COVID-19, also known as the coronavirus, is an ongoing global pandemic of coronavirus disease 2019, COVID-19. Caused by severe acute respiratory syndrome coronavirus 2, SARS-CoV-2.
What is disease? Infectious diseases are diseases caused by living organisms like viruses and bacteria. Described as contagious, they can be passed from person to person through body secretions, insects, or other means.
People with these signs and symptoms may have COVID-19. Fever or chills. Cough. Shortness of breath or difficulty breathing. Fatigue. Muscle or body aches. Headache. Loss of taste or smell. Sore throat. Congestion or runny nose. Nausea or vomiting. Diarrhea. How it spread. It spread from an infected person's mouth or nose in small liquid particles. When they cough, sneeze, gathering and speaking.
Those older people, and those with underlying medical like cardiovascular disease, chronic respiratory disease, diabetes, and cancer, are more likely to develop serious illness. It can cause a very terrible death toll.
People with COVID-19 have had a wide range of symptoms reported, ranging from mild symptoms to severe illness. Symptoms may appear 2 to 14 days after exposure to the virus. Anyone can have mild to severe symptoms. Since 2021, variants of the virus have emerged and become dominant in many countries, with the Delta, Alpha and Beta variants being the most virulent. The World Health Organization, WHO, declared a public health emergency of international concern on January 30, 2020, and a pandemic on March 11 same year. If you are anxious about this COVID-19 pandemic, stay calm. Although the COVID-19 pandemic is extremely frightful, we still have some methods to protect ourselves. Comply with national policies such as wear a mask in public, especially indoors or when physical distancing is not possible. Clean your hands often. Use soap and water or an alcohol-based hand rub. Cover your nose and mouth with your bent elbow or a tissue when you cough or sneeze. Get vaccinated when it's your turn. Follow local guidance about vaccination. Stay home if you feel unwell.
In addition to withstanding the COVID-19 pandemic, scientists invent a few types of vaccine. Pfizer, BioNTech, Sinovac, AstraZeneca, Janssen, Sinopharm, Sputnik V.
Every Malaysian citizen should register for the injection of the vaccine on the MySejahtera app. You can download it on App Store/Play Store. For more information of register vaccines, just refer to this link. Until today, we still don't know why the COVID-19 occurs. But anyway, it is very dangerous to us. No one is immune to this COVID-19 pandemic even though you are vaccinated. The vaccine is just to protect you, not to be acute. The COVID-19 outbreak is proving to be an unprecedented disaster, especially in the most afflicted countries including China, Italy, Iran, and the USA. In all aspects, especially health, social and economic. It is too early to forecast any realistic scenario, but it will have a strong impact worldwide. In high-income countries, especially those already affected by the outbreak, seem to face a catastrophic perspective. In low-income countries there seem to be two possible scenarios. In particular, in the worst-case scenario, when the COVID-19 outbreaks, the majority of countries will be unprepared, with low resources allocated for affording the viral emergency, and the consequences will be catastrophic. Only once this pandemic ends, one will be able to assess the health, social, and economic impact of this global disaster, and we should be able to learn lessons especially in terms of public and global health for any future similar pandemics. We should listen to the advice of the World Health Organization and the government to overcome this difficult time together. #Stay safe, stay home.
Unless a vaccine is administered to all of the world's 8 billion inhabitants who are not currently sick or recovered, COVID-19 is likely to become endemic. It will circulate and make people sick seasonally,
Sometimes very sick.
but if the virus stays in the human population long enough, it will start to infect children when they are young. Those cases are typically, though not always, quite mild, and so far the children appear less likely to develop the severe disease if they get reinfected as adults. The combination of vaccination and natural immunity will protect many of us. The coronavirus.
Like most viruses,
We live on.
but not as a planetary plague.